Hi everybody, it's Dr. Hardell. I'm back on video this week. I'm still kind of swollen, but your nurses, I think you can handle it. All right, let's talk about this week. So, we talked a little bit about this, staying abreast of scholarship of teaching and learning in your field. So we get the double whammy as educators because we've got to keep up on those clinical aspects, and then we've also got to keep up on the teaching scholarship, right? So for me, my full-time job, I work for a school district and I case manage many high acuity children. So I've got to keep up on school nursing as a discipline, general pediatrics, okay? Then for here, for GCU, I try to keep up in general nursing. Adult med surg is what I would consider one of my specialties. I try to keep up on that area. I have dabbled a little bit in the OB and NICU area, but I'm definitely not up to speed on the current. But then I've got general teaching and then online education. So educators really get kind of hit, and depending on what you're going to teach and where you're going to teach, let's say you're teaching in an academic university college, more than likely you're not going to just teach your specialty area. So you might have, let's say you might have fundamentals, you might have med-surg, you might have leadership, you might have research, you might have community. So, hopefully if you work in academia, you will have some place that tries to keep you teaching the same things so that you can really get better at them. But also within an educational setting of the clinical arena, you've got so many different specialty things that you need to, like a hospital, so many different specialty areas. And again, hopefully if you work for a larger hospital or medical center or something, hopefully you'll have responsibility for maybe one group of units or something like that. But wherever you work, you still have this dual challenge of trying to stay clinically competent while also trying to keep up your educational competence. So for me, I get a lot of journals. I belong to organizations, especially organizations that send me journals. I try to I belong to like listservs for different organizations, and I try to attend conferences. But it's a real challenge trying to keep up on all the different areas, especially if you are a full-time educator. If you're a full-time educator, finding time to do clinical practice can be really, really challenging. I did that when I was working for a community college. I worked on a surgical trauma unit as a staff nurse to try to keep my skills up, and time management was a big skill during that period of time. Okay, so we'll talk about that a little bit this week. The other thing I want to talk about is you guys are getting close to graduation, and some of you are already in the education arena. Some of you know kind of what you want to do. Others of you are looking might be looking for a new position, maybe a full-time, maybe an adjunct position, things like that. And so I did post, it was either last week or the week before, those interview questions. So I think it's a good idea to pull those out and kind of take a look. You are probably going to also need to prepare for a teaching demonstration. Definitely in academia, you're going to have a teaching demonstration. And a lot of times I'm seeing more and more healthcare facilities having their educator do a teaching demonstration. And so you want to make sure that you ask about how much time do I have? Do I get to pick the topic? Do you want to pick the topic? What types of people are attending? In academia, I have had situations where there was just fellow faculty there. I've had faculty and administrators. I've had a couple students. So you want to know who will be in on this teaching demonstration. And then you really want to find out what kind of setting is it. Do I have any control over my environment? What kind of equipment do I have available to me? So those are things that you're going to think about if you have to end up doing a teaching demonstration. And then finally, more and more throughout all sorts of healthcare, we're getting more group interviews if you've not interviewed for a position in a while. I see definitely for faculty positions, I see group interviews with existing faculty. For hospital positions, I see more and more, especially in organizations that have espoused shared governance, I see more and more interviews where maybe there's a group of educators or a group of staff and managers that you would do a group interview for. I see more interviews these days doing situational interviewing. Here is a situation, here is a scenario. How would you respond if you were to get this position? I see more of those things coming up. So just some things to think about. I'm getting very excited for you, thinking about your graduation, and I know you guys are going to be great educators, having gotten to know you throughout these 12, 13 weeks. So it's just kind of fun to think about you guys getting out there. All right, so just a few topics there. We've got another NEPD to do this week. If you were getting close to the end of your practicum hours or had finished your practicum hours, I tried to write something on your last NEPD in the faculty comments section to tell you what to write about. So if you're all done with your clinical and have written like I'm done, then after that you'll just fill out the student comments section a couple more times because you won't have any more goals because you're done with your hours. Okay, just final reminder, your preceptor's final evaluation of you is coming up. So make sure you get that to them. You also have an evaluation, I think in, not this week, but next week, where you're going to evaluate your preceptor. And that's really helpful for GCU when we're looking at preceptors that you've worked with. A lot of you know people who have gone to GCU, maybe other people are there in your institution or things, and sometimes people want to use the same preceptor, so it's helpful. Those evaluations are really helpful. And then I think this last week of the course, you are going to be doing a screenshot of Typhon to show your hours and that they've been signed off by your preceptor. Remember, if you don't know how to do a screenshot, Google it, because it's different whether you have Apple or whatever brand computer you have. And so you just want to make sure that your preceptor is now going into Typhon and signing off on those hours, so by that end of that last week, you're able to upload those screenshots. So I think that's about it. I'm very excited to look at your portfolios. I've just glanced at a couple of them, and I'm trying to wrap up a course that just ended yesterday. And so I've got a few assignments to grade for them because I've got to get their final grades in. And I'm hoping maybe by Monday to have your portfolios graded and your scores put up on those. All right, guys. Thanks so much for your hard work on your portfolios. I think that was kind of an interesting project. Hopefully a little enjoyable, but I know it's still school. All right. See you in the main forum.